No one knows for sure why George Eastman became interested in dentistry almost 100 years ago. Some say it's because he watched his mother have 8 teeth extracted without anesthetic. What's important is that he wanted a dental dispensary for indigent school children, so, as he put it, the poor could chew their food as well as the rich. A leader ahead of his time, Eastman also knew how critical it was to increase knowledge through research and education. That's why, in 1917, he founded the Eastman Dental Dispensary, which was later named Eastman Dental Center. The center included clinical service, a research lab addressing tooth decay, and a school for dental hygienists. When the University of Rochester School of Medicine and Dentistry was established, the original intention was to train both medical doctors and dentists. But in 1928, the plans for the dental component were discontinued. Instead, a dental fellows program was established. This became the foundation for today's Center for Oral Biology, where dentists who received their dental degree elsewhere trained for academic careers in research related to oral health and disease. This was an enormously successful program, producing many prominent academic leaders. Dr. Basil Bibby was one of the early fellows and later became the director of the Eastman Dental Dispensary. During his tenure, he strengthened the research and developed postgraduate programs in pediatric dentistry, orthodontics, periodontology, prosthodontics, and general dentistry. Over the next several years, Eastman Dental Center and the University of Rochester became world leaders in many areas of dentistry. Innovative breakthrough research conducted by brilliant minds within Eastman Dental Center and the University of Rochester led to significant changes in our understanding of dental diseases and how to prevent them. Our first faculty members were phenomenal educators and researchers, leading to historic, revolutionary breakthroughs and forever changing the way dentists practice. Eastman Dental Center merged with the University of Rochester Medical Center in 1998, a natural next step evolving from George Eastman's original vision for a close relationship between these two institutions. Helping people in our community who can't afford care continues to be an important part of our mission and service. We've partnered with many local organizations to serve people who need it most. Our signature Smile Mobiles address the critical oral health needs of our city's children. In addition to our main Elmwood Avenue site, we treat adults and children at Eastman Dental Downtown, as well as our clinics inside School 17, Hillside Children's Center, and Monroe Community Hospital. But the basis for everything we do is education. In the clinic or the lab, Eastman Institute for Oral Health has become a recognized leader in postgraduate dental education. Nearly 800 dentists from North America and around the world compete each year to land a postdoctoral residency position in one of our specialty and general dentistry programs. Dr. Fadi Al-Harashi traveled from his home in Syria to participate in Eastman's advanced general dentistry program.
Eastman Dental is one of the best schools, nationwide, and it has prestigious reputation worldwide even. Actually, I had a high expectation for this program, and my experience here exceeds the expectation which I had.
Dr. Marianne Bafil, today a successful prosthodontist, is glad she listened years ago to her instructor, who strongly recommended she attend Eastman Dental Center.
Being at Eastman brought out this passion for dentistry in my heart, because I always loved dentistry. I knew when I was in 6th grade that I wanted to be a dentist. But once I came to Eastman, that passion for dentistry just increased. And I feel that the level of education that I received there just put me a notch above what I could have ever possibly been anywhere else.
Academic dentistry at this institution is really unique among other academic dental institutions across the country. We do 3 things in an exemplary fashion. We provide clinical service to the community, both to people who can't afford it and also to those who want high-quality, multidisciplinary oral health care. We do a great job of educating the future academic leaders, as well as those who are in the profession. And lastly, but very importantly, we break new ground and new knowledge through cutting-edge research in a variety of areas in oral health and oral biology.
The Eastman Institute for Oral Health, ranking in the top 5 for NIH dentistry funding, continues to gain international attention for breakthrough discoveries. Dr. Michel Koo is known for his work on finding novel substances from natural sources, such as cranberries and red wine grapes, that significantly reduce bacteria's ability to form plaque and cause cavities. This will improve the current therapeutic approaches and the knowledge of the disease process. Dr. Robert Berkowitz, professor and chair of pediatric dentistry, has focused on clinical outcomes for severe early childhood caries. His research has opened a window of opportunity to improve clinical outcomes for babies and young children afflicted with this devastating type of dental decay. And Dr. Robert Quivy, director of the Center for Oral Biology, is known for his studies showing how cavity-causing bacteria protect themselves from their own acidic products. He is also Associate Director of Research for the Eastman Institute for Oral Health.
One of the marvelous aspects of the Center for Oral Biology is that the work that is done here has reached far beyond the oral cavity and the craniofacial structures. The fundamental knowledge that we elucidate on how birth defects form, why certain bacteria infect us in the oral and the nasal passages, has everything to do with many other kinds of infectious diseases, many other kinds of birth defects. What we work on are the craniofacial structures and infectious diseases of the mouth, but it has reached far beyond that into every aspect of modern biology. The educational component of the Center for Oral Biology is actually a lifeblood of its operation, as is the residency program at the Eastman Dental Center. What we're about is creating the next generation of clinicians and scientists, and that's an absolutely vital part of our mission. The students keep us alive intellectually. They ask a lot of questions. Sometimes we don't know the answers, and that's where PhD theses and clinical programs are born.
Today, dental and medical specialists work closely together to help patients with unique needs, like baby Sierra, who was born with cleft lip and palate. She will benefit from an entire team dedicated to her care as she grows into an adult.
Everyone we spoke to just had nothing but great things to say about Eastman Dental and Dr. Karp, the strong hospital. I mean, everybody we spoke to told us that this was, you know, the best choice we could make for our child. Sierra's life has been changed forever by everyone here at the Eastman Dental Center and by using the NAM. If we hadn't gone through this process, if we hadn't been driving up here every week and going through this, I mean, she'd be facing so many more surgeries. She wouldn't have the repair that she has now.
A patient with both the pediatric and orthodontic divisions, 15-year-old Caitlin Durant looks forward to picking different colored elastics each visit. Her parents, Ray and Katie, like both the expertise and sense of community Eastman Dental offers.
You take the child to a doctor's office, you want to see a pediatric doctor. I mean, you don't want to go to internal medicine, you go to a pediatric office. When you go to the dentist and you're taking your child, you want to go to a pediatric office. And Eastman Dental, it's good to know, it's comforting, it's rewarding. You know, you feel more at ease when you know that there are pediatric professionals on the other side of the door there. And it's not just a hello, goodbye, and I'll see you later in 6 months. You develop a relationship, and that's what's exciting. Going to Eastman Dental is like going to Wegmans or going to Tops. You're always going to bump into somebody you know. You know, I love that. I love that.
True, though.
Today, Eastman Institute for Oral Health is ideally positioned to positively change people's lives well into the future.
This is an extraordinarily exciting time in research. We actually have the opportunity in the near future and the vision to see somewhat into the distant future, more distant future. We have an opportunity to take the basic knowledge from our scientific efforts and turn that into a translational product for clinicians to use to improve patients' lives.
Everywhere you go, you don't see medical professionals put the time and effort and care into their patients of what I've experienced here.
If I never went to the Eastman Dental Center and took the advice of that one instructor long ago, I don't think I would be who I am today. Not only as a person, but also as a practicing specialist.
The Eastman Institute for Oral Health is an appropriate and accurate way to describe what we are doing and plan to do in the future in clinical care, in education, and in research.